Hello and welcome to the Fertility Foundations podcast, where we go into detail about how to prepare the foundations for a healthy pregnancy. We dive deep into the underlying root causes for fertility issues and natural solutions. I want you to know that you're not alone and you're not broken. I hope that by sharing these episodes, it will help you move from feeling overwhelmed and lost to feeling hopeful and empowered to take charge of your own path to parenthood, because there are actually lots of things that you can do to help rewrite your own story. I'm Sandra Greenbank, nutritional therapist, functional medicine practitioner, coach and educator, specializing in fertility, pregnancy and postpartum health. I'm also the founder of the Fertility Nutrition Center, where you can find fully trained experts in nutrition, lifestyle and functional approaches to healthy fertility and pregnancy. You can find out more information over at www.fertilitynutritioncenter.org and also book in a free strategy call with one of our experts. Today, I'm speaking with Debbie Cotton all about the vaginal microbiome. This podcast is sponsored by Invivo Healthcare, a human microbiome company. They specialize in accurate testing of different microbiomes, such as the gut, vagina, or a urinary tract, as well as a range of specially created supplements focused on the microbiomes. They support healthcare providers and their clients navigate the complex world of the human microbiomes and is one of the most used labs and supplements by our fertility specialists. Visit their website for more information at www.invivohealthcare.com. Now let's get into today's interview with Debbie. Hi Debbie, thank you for coming on to the podcast and talking to us about the vaginal microbiome.
Oh, my pleasure. Thank you for having me.
Would you like to give the listeners a brief introduction of who you are?
Sure. So my name is Debbie Cotton. I'm the head of clinical innovation at Invivo UK, which is a microbiome company. We specialize in testing the microbiome and everything around the human microbiome. And I'm also a naturopath and a psychotherapist for many years.
Oh, great. God, what an amazing collection of skills. So you mentioned the microbiome. So, our understanding is obviously that there are lots of different microbiomes, but what is a microbiome?
That's a really good question. Basically, a microbiome describes an area or an environment is probably the best word, in which there is both an environment and a community of microbes that live within that environment. So the term microbiome is describing both the environment and the microbes together as one. Now, there are lots of microbiomes everywhere. Like if we think about the human body, the most well-known one is the gut microbiome, but you've also got a nasal microbiome, an armpit microbiome, a vaginal microbiome. Like everywhere in your body is a little kind of environmental niche, which is going to attract a different community of microbes that live there. And those community of microbes are really important because what they do is not only are we giving them a home, but in return, they give us lots of benefits for being there. So they make lots of different metabolites and other things that we can use and it can impact us as a human being as well. And there's also, microbiomes outside of your body, in the home, in your bathroom, in your environment around you, depending what city you live, so on and so forth.
Yeah. And these microbiomes are obviously shared. So families will share generally, those who live together will share microbiomes and those and partners, and you share your microbiome with your children, and they actually inherit your microbiome as such through the vagina when they're born, and also through the placenta and some from the breast milk, don't they? But when we're talking specifically about the vaginal microbiome, then could you explain a little bit more about what that is and what community we're looking for in the environment?
Absolutely. So if we had this conversation probably 10, 15 years ago, the term vaginal microbiome was not common then at all. It was either your vagina was okay or you had thrush. So it was like you had bad bugs, or there was no thought of what was there living on a day-to-day basis. And what's kind of happened and exploded in microbiome science in the last kind of 10 to 15 years is we can test the microbiome in very, very different ways these days. And it's called DNA technology. So it can pick up types of microbes that don't necessarily like to grow on the old culture techniques that we still use to an extent, but a lot of microbes don't like oxygen, so they're not going to grow in sort of a culture technique. So when you use these DNA techniques, and you would have heard of PCR because of COVID, but there's other ones out there like NGS and others as well. And basically what they can do is they can pick up the whole story of microbes that are living in environment. So what that has then shown us is an explosion of research into the vaginal microbiome. So it's a bit like, if I kind of revert to the gut microbiome for a moment, because we know a lot more about that, which is, basically we know there's communities that live in the gut that do healthy stuff for us, known as commensal bacteria, or the good bacteria. And then you've got kind of pathogenic bacteria, or ones that can cause disease. Then you've got ones that kind of sit in the middle. They're neither good, neither bad. They'll kind of be there because there's room. They only become a problem when they overgrow, and they're called pathobionts. Now, this same concept applies to the vaginal microbiome. We have what's known as a commensal, or a healthy vaginal microbiome. And I said that, like I said, that's something very new that we've only just realized in the last 10 to 15 years. We then have a group of bacteria that live in the vaginal microbiome that don't really cause a problem, but can do if they overgrow, and they're known as the pathobionts. And then obviously what people know a lot about is the pathogens that can, live in the vaginal microbiome. And these are generally thought of as sexually transmitted diseases and viruses and so on and so forth. So it's really lovely to think that we have got a community of bacteria that live in our vagina that actually are there to protect us, to offer sort of metabolites and things that will enhance the actual vaginal environment. And that, that's by looking after them, that helps to look after our vagina as well.
Yeah. And there's actually quite a bit of research by Tommy's Miscarriage Charity that came out a couple of years ago that's sort of been really helpful to me, and sort of helping clients understand, or patients understand, that this is not sort of hocus pocus. It does have an impact on your risk of miscarriage, or and pregnancy outcomes. And so what are the infections that you generally see at Invivo that are sort of potentially harmful for fertility, aside from the ones that we know, like chlamydia, gonorrhea? Those are checked anyway in the sort of conventional setting, but there's bacteria that we screen for that just is not checked by doctors or IVF clinics or fertility clinics or in the conventional setting yet. I'm sure that this is coming, but at the moment it's not. So what are the infections that you're seeing are causing particular problems?
So I think that's I'm going to backtrack a little bit and just kind of answer your question in a long-winded way, which is, I think the first thing to realize is when we think about fertility and the vaginal microbiome, like you mentioned, the Tommy study that just came out, they weren't even looking necessarily at infections in the vaginal microbiome. They were looking at a lack of the commensal bacteria that can live in the microbiome. And generally in women of reproductive age, the vaginal microbiome is heavily dominated by lactobacilli bacteria. And why lactobacilli? Well, lactobacilli tend to make sort of lactic acid and hydrogen peroxide. And you can hear from the names of those two things, they're rather acidic. And that acidity actually creates an environment which stops the overgrowth of other bacteria. So it's kind of making it inhospitable to other bacteria growing in there. Now, there will always be a small percentage of other bacteria that just like to live in there that are normal and natural. But if they overgrow, if the lactobacilli go down and they overgrow, you can end up with what we call states of dysbiosis or imbalance. And they're generally termed medically things like bacterial vaginosis. You may know of thrush, which is, of course, a fungal species. And the other one is known as aerobic vaginitis, which is, again, it's a little bit like bacterial vaginosis, but just involves different class of bacteria and can give sort of different symptoms. Now, those bacteria involved are all, I wouldn't call them infections. They're just bacteria that do live in your vagina normally and naturally, but they take an opportunity as soon as your lactobacilli drop to overgrow. And so in fertility, and what we see the most of here in kind of testing and things like that is kind of imbalances in the vaginal microbiome, either kind of moving towards a kind of a pattern that could be indicative of something like bacterial vaginosis or aerobic vaginitis. And that in itself creates a vaginal microbiome that's not necessarily hospitable to things like sperm. It can change the pH. You can get damage to the epithelial barrier of the vagina, so that can result in pain, but sometimes no symptoms at all. But what it can then result in is inflammation in the area, and that inflammation can activate sort of things like your natural killer cells and your immune system, which obviously is often a big problem when you're trying to receive an egg. You don't want your immune system overactivated in that area. So, and this is then leading back to the Tommy's research, that's what they were looking at. They were looking at, well, if we get a group of women that have had a miscarriage and we screen out the ones that we know it was genetic problems. So they took out all of the ones where the miscarriage was explained by the embryo and the genetics of the embryo. So they looked at only the unexplained ones, and then they looked for the amount of lactobacilli that these women carried. And what they found is women with lower lactobacilli, so more likely to have bacterial vaginosis and so on and so forth, had a higher the higher increased risk of miscarriage. And this has been replicated in other studies in different ways as well, in different parts of the world, and in coming from different methodologies, kind of looking at, well, if you've got bacterial vaginosis, there's an increased risk possibly of miscarriage or of preterm birth. And also things like aerobic vaginitis. One of the bacteria that is quite common there is Streptococcus B. And Strep B is obviously been associated with kind of preterm births and actually can be a bit of a problem in labour, because sometimes if you pass it on to the baby, that's not great as well. So often needs to be treated with antibiotics. So these things are becoming more well documented. And like I said, they're not necessarily infections, they're imbalances that can be addressed and can be kind of worked with at those early stages when you're thinking about conceiving.
Yeah, and I just to clarify for those who don't know what an epithelial cell is, so it's basically the lining of the wall of the vagina, and that also has an impact on the health of the vagina. And you mentioned inflammation as well, and actually one of the Tommy's studies, if not both, did also link inflammation levels with risk of miscarriage as well, and that is something that we also measure on it's called the female ecologics, the test that we use from Invivo. So that's also shown. And yeah, you mentioned the bacterial vaginosis and the strep bacteria as well. And the conventional treatment is antibiotics. And of course, what do antibiotics do? They don't just wipe out the unhelpful bacteria, it wipes out the lactobacilli as well. So we end up in a situation where, certainly with bacterial vaginosis, I'm going to stop saying bacterial vaginosis and just call it BV.
Yeah, that's definitely an easier version.
So with BV, it tends to reoccur if you take antibiotics and that's all you do, because it just doesn't necessarily the most helpful way to get rid of it and to keep it, help it stay away, is it?
And that's right. That's antibiotics can be helpful when they're needed. Sometimes some infections are hard to move and they need a little bit of a push in the right direction. But what's really important, and I think often in conventional medicine and in conventional testing, we test for the pathogens, we don't test for the good guys. Mm-hmm. So knowing what your lactobacilli levels is, and then after antibiotic treatment or whatever treatment you've had, working towards improving, restoring, supporting your lactobacilli or your vaginal microbiome in general, you're giving yourself your own shield. You're giving yourself your own ability to kind of, because these lactobacilli do lots of things. They also regulate inflammation in the area. And like I said, they stop the overgrowth of other pathogenic bacteria. And there has been some studies in IVF where Even they looked at using lactobacilli on kind of one of the catheters, and that kind of improved the outcomes as well. So it's just realizing that they probably play more roles than we even know about, basically, in the process. And I think that's the thing of anything that I'd like to kind of get across today, is how important it is to take care of your vaginal microbiome, not necessarily that it's another thing to panic about treating and kind of trying to decimate something that you think you might have infection wise.
Yeah, absolutely. I think there's one organism that does come up that we do tend to go for antibiotics with, and that's ureaplasma.
Mm-hmm.
A little bit about ureaplasma.
Yeah, so ureaplasma is a bit of an interesting one. There's a few different species of ureaplasma. There's ureaplasma parvum and ureaplasma urolyticum. And basically, a lot of women carry ureaplasma, and it's very normal and natural. And, you know, in a lot of cases, they can fall pregnant naturally with it, and it's not going to be a problem to the microbiome. Sometimes it is a part of a BV picture, so it's kind of coupled with a whole heap of other bacteria that, you know, it's just kind of holding on to a BV community. Now, that's in most individuals. When you're an individual that's maybe had reproductive issues in the past or has had miscarriage before, ureaplasma becomes slightly a higher risk when we look at the epidemiology of possibly recurrent miscarriage. So often, if you are having fertility issues and we see ureaplasma kind of in quite high levels in your microbiome in comparison to your lactobacilli, so that's what is important, is how much is there, not just necessarily that you carry it, then you may work with your practitioner to try and reduce it or eradicate it. And so this is kind of quite niche for a subset of people, like I said, that are more having fertility issues or going for IVF. They might decide to look at reducing or even treating that ureaplasma with antibiotics. But in kind of, like I said, in the majority of the population, a little bit of ureaplasma is normally not too much of a problem. So it's kind of, if there's already something underlying there, it seems to add into the kind of inflammation pattern that's going on. And so that's why we often want to work with eradicating it and then working again with that vaginal microbiome to restore the lactobacilli.
Yeah. I mean, obviously, we're speaking now to those who are trying to conceive, most likely that's who's listening, because that's what this podcast is about. And the other kind of thing to bear in mind is, because it's shared, the male partner is very likely to also carry it. And ureaplasma does impact male fertility.
Again, it can do. Yeah, there is a possibility that it can impact male fertility as well. And again, it's just remembering that some of these microbes, it depends on context. It really, really does depend on the context of the person and the couple present. But yes, if the woman is if the man and the woman trying to conceive both carry ureaplasma and they're having issues, it's something I would like to address in both the couple.
Yeah, absolutely. And this is simple. I mean, the male seminal microbiome is the sort of, you know, we're only beginning to explore that galaxy. Like, there's so much more unknown, but there are things that we do know. And there's, you know, if you go on PubMed, for example, you can Google certain strains of bacteria and, you know, how they might be impacted in male fertility. And there's some research. And what we do tend to do then is, actually, if it's found in one partner, we tend to recommend that they use a barrier form of contraception until both partners have at least been checked and treated, so that it's not passed back and forth as well. And you know, it is really lovely to be able to use natural compounds and sort of test and retest, but often we simply don't have time because there's a treatment cycle coming up, or, you know, and then, you know, we just have to make the best that we can of the situation with the time that we have and the resources that we have. And, you know, it's all very personalized, isn't it? Because it does also depend on how much of the healthy community you've got and what else is going on as well.
Absolutely. And that's the thing, is it's that thing, isn't it, of really reading sort of the vaginal microbiome in light with your symptoms, in light with your kind of the whole context of the person and the couple that are trying to conceive. And that's, just seeing something in a test doesn't mean, I have to treat it immediately. And that's why it's really important to work with people like yourself and, practitioners that are really specialized in this area. So I think they can actually go to you, no, that's not a problem. We're not going to address that because of X, Y, and Z. Or yes, that is a problem and we're going to address it quickly. And this is why. So, and I think that's really, really important is sometimes, especially with pathobionts like this, it's really hard to kind of get a context on them. And that's what your healthcare professional is so good at doing, because they put all of your symptoms together and all of your health history and all of that information. And that's what makes the key decision at the end of the day, not just because we've seen something in a test. So.
And I thought actually it sort of makes me think of sort of the way we look at a couple who are trying to conceive, and that, it doesn't have to be a male and a female. It could be, any combination of
absolutely.
But we see you as one, and so it's very holistic. It's sort of looking at what is going on in the interplay between the two of you and your lifestyle and everything that you do together and that you come into contact with, as opposed to your IVF consultant who literally sees you as like a walking pair of ovaries. And that's it. And it's like completely disconnected to anything that's going on in your life and in your world. I think that also the hormones are very impactful as well on the vaginal microbiome through the ages, but also through the month. So if you talk a little bit more about that as well.
Absolutely. So the vaginal microbiome is really dependent on the host, which is us. And what we do in our reproductive years, when we've got rich amounts of estrogen around, there's a lot of estrogen receptors that are within your vaginal wall. And also that's where you make a lot of mucus from, is both in your cervical cells and in your vagina as well. And when we're under high levels of estrogen and or progesterone, but mainly estrogen, what we get is our mucus is really, really rich in glycogen as a fuel source, specifically for like lactobacilli, which they love to eat. So basically we bother to make a fuel to feed the vaginal microbes we want. So there's a really kind of beautiful two-direction relationship there. Now, pre-pubertal and also after menopause, our vaginal microbiome changes. We still have lactobacilli in there, but it's not as dominant as it was before. And that's mainly because of the lack of estrogen, we haven't got that rich mucus that's feeding the lactobacilli anymore. So it's harder for them to dominate. So you get much more of a sort of a pattern that might even look a little bit like BV. It might not have the symptoms of BV, but it's a little bit more diverse, because vaginal microbiome generally isn't kind of highly diverse. It's normally got that dominant strain. And this, so when we're looking at fertility in women that are coming up to menopause or in the perimenopause state, and we're looking at the vaginal microbiome, that's one thing we might want to look at, is how do we need to feed those lactobacilli and keep them there, and that might be around what medications you're using with your consultant. It might be around what nutrition plans you're using with your nutritional therapist. It might also be around, certain application of douches or things like that you might be using from the pharmacy that might just help to acidify the area to be able to improve the growth of lactobacilli. So there's lots of ways that we can approach that, but it's just really important to kind of realize that is a normal part of the aging process. But when it comes to fertility, it's something we want to try and protect against as best as possible, because again, that lovely lactobacilli rich environment is really important.
Yeah, and that does become more of a consideration when somebody's trying to conceive when they're a little bit older, because, as we know, the perimenopause can take 10 or so years before you sort of reach menopause. And it's not like one day you fall off a cliff. I mean, hopefully, the transition isn't so bad anyway, but, those changes start to happen and estrogen starts to sort of perhaps struggle a bit sometimes, and it can be a bit up and down for quite some time. And you might not have any symptoms, and also you might not have symptoms if you've got, and I think it's important to mention that as well, if there is an imbalance in the bacteria, you don't necessarily have any symptoms, you wouldn't necessarily know.
Yeah, some people do and some people don't. And that's the thing. And some people might just have symptoms coming up to, when drops of estrogen are at their lowest, so coming up to their period or just after. Some people might realize they get BV and thrush because they notice a change in smell. And like you say, some people may not realize, and that might be why your professional is asking you to kind of test, especially in a kind of fertility workup, because they just want to give you that kind of that overview of, what are the positive steps that you can make to try and protect that area as much as possible.
Yeah, absolutely. In terms of looking after your vaginal microbiome, what are some of the things that people can start doing at home?
Yeah, absolutely. There's quite a lot you can do kind of. So first and foremost is wearing breathable knickers. It's a really good start. So just, it's we all wear sports gear and stuff sometime, but it's really important to change that and kind of, because sweat can change the pH of the vaginal microbiome. We also want to think about eating a diet that's really, really rich in lactobacilli fuel sources. So if we feed the lactobacilli in the gut, there is some translocation that happens from the gut into the vagina. So, using lots of fermented foods, using prebiotics that lactobacilli like to eat, all of, foods that contain lactobacilli, like fermented, if you're okay with dairy, that is, like fermented yogurts and things that are rich in lactobacilli, all of these things are going to contribute. The other thing is to avoid using anything in the area that will wash out the vaginal microbiome. So you don't need any harsh soaps inside your vagina. You don't need any douches in your vagina to make it smell nice, unless you've been kind of advised by a healthcare professional to do it under a certain kind of amount of time. But, none of those smelly sprays, any of those things, because they'll contain chemicals, again, that will change the pH of the vagina. Another really important one is not smoking, but hopefully you're not doing that anyway if you're conceiving, because that can impact the vaginal microbiome as well. And also things like, with intercourse, it's kind of thinking about, if you're using sex toys, making sure you're cleaning them and sterilizing them regularly. If you are doing anal to vaginal sex, maybe do it the other way around, vaginal to anal, so you're not spreading microbes into the vagina as much as possible. You also want to think about kind of same-sex couples might want to think about the oral sex can change the pH of the vagina as well. So it might mean sometimes after oral sex, if you find that you're getting a little bit of BV, it might be using kind of a lactic acid pessary in the vagina just to kind of combat that and things like that as well. So there is quite a lot you can be thinking about and doing. And again, your healthcare professional might have some more quite specific advice for you around that too. And the other thing also that I haven't mentioned is things like tampons and pads and things like that. And if possible, try to make sure you change them often, make sure you're using organic versions that have got no chemicals in, because all of those can have an impact on the vaginal microbiome too.
Absolutely. I think because you mentioned perfumes, and I only use the organic kind of some brands are, I think, Natracare, and can't think of any others off the top of my head, but
Natracare Dame is a quite a good one as well.
Yeah.
And Sisters is another really nice brand as well, of kind of all of those a kind of organic period care, which you can get in kind of most major supermarkets now.
And now, yeah, but I mean, every so often I'm sort of forced to get a conventional product, and it's actually so different, and they're perfumed and they're made from plastic.
Yeah, they feel different. Yeah,
it's just awful, and I'm thinking, this is causing so much damage. And just think of wearing these every month from the age of 13, 14, 15, and then by the time you come to try to conceive 20 years later, it actually could really have disrupted something over the long period of time. And it's just so unnecessary to, why. And also I just think young women, like young girls, should not be taught that there's something that needs to be changed or perfumed, or that there's something wrong with the smell. I feel so strongly about this industry, and it's so good, it's so good with all of these organizations now that are sort of trying to raise awareness.
Yeah, absolutely. And, there's been an explosion, hasn't there, in the last 5 years of good period care underwear and stuff as well. So, there's lots of lovely options out there now.
And I think, what about period pants? I've yet to try those actually, but they're so popular, but I know that some of them can also contain some potentially toxic ingredients.
Yeah, so again, some of them can contain some toxic ingredients, like anything that's made without really being thought about, and the plastics that are being put in them. But as long as you, again, looking at brands that have thought about their period care and that are kind of made from organic cotton and those sort of things, they can be really, really helpful. Again, the major thing is changing them regularly, because if you're kind of sitting in menstrual blood, either your pads or stuff for too long, that's going to change the pH and the microbiome as well. So we definitely want to make sure that that you've got a kind of a good supply to change them and wash them well.
Yeah, because that's the thing, isn't it? It's the pH of the menstrual blood that can actually, and those who have symptoms after the period or in conjunction with the period or after sexual intercourse without a barrier contraception are the ones that probably would like to just get, investigate whether they've got potentially BV, because it's the pH difference.
That's right.
Fluid that's causing the opportunity for the bacteria to grow.
Yeah, absolutely. And that's the thing, is you can think you're picking up something off your partner, but actually it's more likely it's just a change in pH at that time. And also, the friction, sometimes if you are not producing a lot of mucus because your estrogen's a bit low and you've produced some friction and damaged some cells, that's also going to create inflammation, which is going to change the microbes as well. So it's kind of a picture of all of it. So it's just making sure you're comfortable. And that would be the other thing I would say is, if you're using lube, and actually do use lube if you need it, because you want to prevent that sort of damage, just making sure it's something that's pH suitable, and again, not containing lots of petroleum or anything along those lines. You want kind of something very natural and pH balanced for the vagina, so that it's going to be helpful for you.
Yeah, there's one called Yes Baby, which is fertility friendly, that we tend to recommend. Yeah, absolutely. That's really important to look after the tissue on the inside as well.
Yeah.
What about wearing thongs?
Not a great kind of thing, because it kind of can help translocation of the microbes kind of from the gut to the vagina. And if they're not the microbes you want, that's not super helpful. But again, probably change them more often than you think, if you're having problems, but preferable not to wear them if you can avoid them. But, every now and again, because that dress requires it, then fair enough.
Oh yeah, but on a sort of daily basis.
On a daily basis, yeah, granny undies the whole way.
There's one organism that comes up sometimes, it's called Enterococcus faecalis, I think.
That's right. And Enterococcus faecalis often can move from lots of places, the gut and fingers and other places around the body. It lives everywhere. And but if that that can really kind of increase translocation from other places. So yeah, that's something we want to try and avoid.
And that's also one that then for the male partner can be very unhelpful.
Absolutely.
What about menstrual cups?
Menstrual cups are fine. Again, just making sure you're changing them often. And I would always recommend that you have two, because what people tend to do is use them and quickly rinse them out and then pop them back up again, but they're not necessarily sterilizing them. So like anything that goes up in your vagina, it is worth sterilizing it. So it is having, one you wear one day and then you can sterilize the other one by kind of the boiling method or something along those lines. Just don't overboil it and boil your pot dry. You're going to damage your cup. But, and just kind of just having one to making sure that you're doing that. And the same with any silicone sex toys and stuff like that. They should really be sterilized.
With Milton tabs type thing, or
you can use Milton tabs. I tend just the boiling method is fine. So just kind of
my menstrual cup and I
burnt it.
Melted. Oh, hang on, was that? Oh no, hang on, that was maybe my diaphragm. Something. I can't wear a menstrual cup anymore anyway because I've got endometriosis and the pain is indescribable. So
Yeah, I've never got on with a menstrual cup either, but I know some women really, really do prefer to use it. And so, it's choice. It's what's best for your body. So
yeah. And how often should you wear tampons if that's your preferred type of product?
Or how often you should change them.
Yeah.
Just the main thing is I wouldn't recommend sleeping in tampons overnight. You know what I mean? Like, you want to prevent toxic shock syndrome was something that we all got kind of taught years ago, but that's actually from something like streptococcus that can grow on tampons if you leave them in for too long. So you do want to change them regularly. If you are having a bowel movement, change the tampon. Like, make sure you've put a clean one up.
Naturally, do that anyway.
Yeah. So, so they're the sort of things that you want to think about. And like I said, overnight, I would use period undies, or I would use a pad, or a combination of both. So, yeah.
What about cleaning? Like, what should you use to clean your
water? Basically, and I know people get a bit shocked by this, but your vagina doesn't need, especially, and let's just take an anatomical break. Your vagina is the bit inside that we're talking about. Okay, so the top of your vulva, possibly you might need a little bit of very pH balanced soap occasionally, in your period or whatever it might be, but you don't need to clean inside your vagina. It's a self-cleaning mechanism. So it's just, all it requires is water, because, soaps can really, really disrupt the vaginal microbiome. They can strip the vaginal microbiome in some cases as well. And, then you're going to create pH problems, which can, you might feel better for a minute, but actually what you're actually doing is creating the overgrowth of bacteria that can then change the smell. So, that's what we want to kind of avoid as best as possible.
Where I come from in Sweden, there's lactic acid soaps that are just
lovely,
unscented, and they've been around for years. But and also when you go to pharmacies in Europe, you can find them. But for some reason, they're just not around here. I don't know why.
No, they're not very common here. But lactic acid, I know it sounds again scary because it's an acid, but actually that's what the lactobacilli make. So using lactic acid is going to kind of match the vaginal pH.
And there was another question I wanted to ask you. So we talked about cleaning, we talked about period products. You mentioned diet, and you said prebiotics. Can you give
So prebiotics are basically a special class of fiber. So all fiber is really good for your microbiome, full stop, okay? Because it kind of gives it fuel that it can use in different ways, or sometimes it just helps to move things through, or whatever it might do. There are some types of fiber known as prebiotics, and that's because we know specifically if you eat those types of fiber, it will feed certain communities of bacteria. So things like lactobacilli and bifidobacterium, like short chain sort of fibers, little fibers. One that we know of quite well is galacto-oligosaccharides, sometimes called GOS for short, which were kind of a copy of what's found in breast milk, which are human milk oligosaccharides. So that's how kind of clever we are. In breast milk, we actually make and spend a lot of time making fibers that are specifically to feed the microbiome we want. And in breast milk, it's ones that often feed bifidobacterium and a little bit of lactobacilli as well. So often, if we're trying to look after our vaginal microbiome, we do want to think about eating lots of fiber in our diet, and especially prebiotic fiber as well, without causing too much bloating or gas. It's a balance, but it's really, really important for the health of all of your microbiomes.
And so foods that are classically known to cause gas, that they're kind of the helpful ones to include?
A lot of the times they can be, yeah. So things like beans, lentils are often quite rich in types of GOS, the alpha GOS. They've also got different types of fiber in there as well. Foods that are rich in inulin are really, really good because they contain fructooligosaccharides, but they are the ones that for some people can cause a little bit of bloating as well. But that's things like bananas, Jerusalem artichokes, chicory, all of all of those sort of things as well. So again, it's working with your nutritional therapist, I think, in kind of finding what's the most tolerable prebiotic fibers for you, because not everyone's going to be the same. Onions and garlic are a great source of fiber, these particular types of prebiotic fiber. But again, it just depends. What's the amount that's your medicine and not your poison?
Yeah, I mean, I think you can build up a tolerance to those foods, but you might not want to go in with sort of all of them in one go and sort of really high amounts.
Yeah, exactly. And you build up a tolerance by building up your microbiome. Basically, that's what you're doing, is you're feeding a microbiome that can really kind of digest them well. So,
and so just very briefly, because we're doing a separate episode on the gut microbiome, but with Invivo, so you have a number of tests that test the different microbiomes. And actually, we use them all with our fertility clients because they are all impactful. And we've already interviewed Dr. Victoria Sampson about the oral microbiome. So that's available to listen for anyone who's interested in that. And that to me, when we started doing that, was just mind-blowing. And the links between the oral microbiome and fertility is like, it still blows my mind. And it's such an interesting place to work. So we've got the test for the oral and gut as well, and the vagina, and then the urinary microbiome as well.
Yeah, the urinary microbiome, because in a lot of women that have chronic urinary tract infections, and again, this is only very new, this kind of science, that actually, when we used to talk about the urinary bladder, we used to talk about it as sterile. But actually, now that we've got these new testing methodologies, we realize actually there is a bit of an indigenous population that lives in the bladder in healthy women. And again, it's generally lactobacilli again, and which is kind of no surprise, really, if you think about the communication with the vaginal microbiome. And that tends to offer protection against sort of pathogen ingress and overgrowth and those sort of things. So that is another kind of microbiome site that we do test. And for some women with chronic urinary tract infections, they might choose to test both the vaginal and urinary together, because obviously they both can communicate with each other quite strongly.
And I have actually found that women who have recurrent urinary tract infections who have come to see me because they're trying to conceive, I found that often it's actually something that's passed on from the male partner again. So it can be all very much interlinked.
Absolutely. And there's that thing, isn't it, is remembering, there's so much communication that goes on there. And especially with male female sex, you get a lot of trauma of kind of things being pushed up the urethra. So it could be something from the vagina that gets pushed up in the process, or something from the semen. So it's just being aware that if you have got a bit of a weakness there, kind of thinking about, well, how can I protect that area and work with the microbiome and protect it as much as possible as well.
And if you have a short urethra, that tends to be, those people tend to have more of a risk of infections, I suppose. And also in pregnancy, that tends to sometimes get a bit worse because there's lots of changes that happen.
Yeah, absolutely. And like you say, UTIs do sometimes kind of crop up in pregnancy as well. And it's something that, again, looking after your lactobacilli, maybe what I haven't mentioned is you can take live bacteria orally, both for the vaginal microbiome, for the bladder microbiome, because even taking them by mouth, they do make it there, which is quite amazing. So, and that can have a really big kind of impact on kind of being a source of live bacteria that you can kind of influence your vaginal and urinary microbiome with.
And we mentioned pregnancy, and I prefer to work with people before they get pregnant to fix, quote unquote, fix the vaginal microbiome. Because you talk a little bit more about the implications in pregnancy of working on changing the health of the vaginal tract?
Yeah, so once in pregnancy, a lot of the antimicrobials that maybe a natural health practitioner would like to use are kind of contraindicated, but also we don't really want to keep disrupting all the microbiomes in pregnancy with taking antibiotics if we can help it. So, and, if they're needed, absolutely. But, if it's kind of best to avoid them where we can. So in pregnancy, generally, we really want to concentrate on kind of diet as a good intervention, your live bacteria. So probiotics are safe to take in pregnancy. These are the things that we can make an influence in when you're already in a kind of a pregnant state. And the reason we want to kind of keep away from kind of infection is because it can start an inflammatory pathway that can then increase the risk of preterm birth, because we don't want your cervix ripening too quickly, basically because of, cytokines, which are inflammatory molecules being released, which normally is what signals birth. So that's one of the reasons we want to try and keep on top of infections. And, like I said, if antibiotics are necessarily, absolutely use them. It's really important because we want to prevent that kind of inflammatory cascade.
Yeah, I mean, what does happen in pregnancy is if you go for a swab and they find either BV bacteria or group B strep, you will be given antibiotics.
Yeah, absolutely.
And of course, that has an impact on the lactobacillus, and the knock-on effect is potentially that your baby during birth then doesn't get as much of a benefit from your vaginal tract as they could or would have done. So, it's a really nice thing to work on before pregnancy, isn't it? And I mean, group B strep is transient, but I had it isolated during pregnancy, actually, on a swab. And no matter what, you will be put on antibiotics, on IV antibiotics during birth, which means that you're not allowed to go in the midwife-led center. You have to go and have a medicalized or more of a medicalized birth situation. So it does change your birth plan as well, which can be very upsetting.
Yeah, the NHS has got a bit of an interesting. They've got kind of, it depends. They've got a kind of a new guideline on that at the moment, and basically, if your waters break early, within kind of 24 hours, you've got a 24-hour window where they're going to encourage just sort of a normal birth. But what they'll do is they'll watch you for temperature and they'll watch the baby's temperature really often. And if there's a spike in either, then they're going to come in with the antibiotics then. And again, they probably don't generally jump in with the antibiotics. They keep a watch on temperature for looking for infection. So it gives a little bit more of a leeway. But yes, if you go over that 24 hours, you're going to be on IV antibiotics and go from there.
I was, and I think it seems that the NICE guidelines might change, but then it can take years for each hospital to actually change.
Yes, I was just about to say that this is going to vary borough from borough, unfortunately. Yeah. So there might be guideline changes, but there's not necessarily implementation of them. So, yeah.
Yeah, but I found it quite upsetting because I had home births with my first two, and then it was like strapped up onto a bed, lie on your back, and all the things that are then sort of potentially going to it's that sort of cascade of intervention. But they actually, as they were going to get the antibiotics for me, I gave birth in that time. She came out really quickly, and then what happened was, like you said, they kept me in and they watched her, and she was fine. So but it's not an infection that you want to sort of mess around with. I think it is, the risks can be quite high.
Yeah, the risks are very, very high. So it is something that, if found at 36, 40, 38 weeks, it's something you want to deal with immediately and to the best of your ability. So, yeah.
So, okay. Well, thanks so much for that kind of quick whistle-stop tour of the vagina.
Oh, pleasure.
Is there anything else you want, any sort of parting advice for somebody who's trying to conceive and thinking, could this, could this be something that I need to look into?
Yeah, look, I would say definitely talk to your natural health care practitioner about this and what you could be doing. Testing is great if you can see, making sure it's not just a test for pathogens, but testing for kind of the healthy lactobacilli as well. But again, depends on your sort of your scope and your funds and all those sort of things. But, working with your healthcare professional, your natural one, there's, like we mentioned, there's so many things that you could be putting into place anyway that could be protective of your vaginal microbiome. So you could be working in that space anyway and working towards that goal.
It just gives people another another area where they can actually take charge and it's sort of empowering you to do something that might be positive for your fertility.
Yeah.
And
positive for fertility, but also is going to be positive for your sex life. It's going to be positive for how you feel about yourself. Like, the vagina plays quite a big role in our lives. So I think as a part of that, I think it's really important to take ownership and kind of know your microbiome and work with it in the way that works for you.
Absolutely. Thank you so much.
My pleasure. Thank you for having me.
I really enjoyed this chat with Debbie, and I hope you enjoyed listening to this episode. Please like, share, save, and rate this podcast if you find it useful, as it helps us reach more people. And if you're looking for a fertility specialist to support you, our practitioners can be contacted over at www.fertilitynutritioncenter.org. They offer a free strategy call to help you decide on your best next steps on your journey. Thank you for listening.